Today, Cities of Migration presents Healthy Living, Promoting Health and Safety in Immigrant Communities. In the next hour, we'll learn about innovative health and safety initiatives in Auckland and Vancouver that promote healthy living through community education and accessible programming that ensures new immigrants and their families are safe, sound, and empowered to seek solutions for their personal well-being. I'm delighted to welcome today's presenters. Stacey Wilcox joins us from WaterSafe Auckland in New Zealand, and Lynn Moran joins us from AMSA, the Affiliation of Multicultural Societies and Service Agencies in Vancouver, Canada. As we hear about these health and safety promotion strategies and the success these programs have achieved, I ask all of you to imagine how today's good ideas might be adapted in your own city. Once again, please feel free to submit your questions for the Q&A in the chat box on the left of your screen anytime during the webinar. Now please join me in welcoming our first presenter. From Auckland, New Zealand, we welcome Stacey Wilcox, the Drowning Prevention Coordinator at WaterSafe Auckland, to talk about how the new Settler Water Safety Reference Group has addressed migrant drowning prevention, water safety promotion, and public education. Hello, Stacey. Welcome to the Learning Exchange. Please tell us about your good idea. The virtual podium is yours.
Thank you very much, Piali. Thank you for inviting me and having me share our experiences with your audience. Just to give a bit of background, WaterSafe Auckland promotes water safety and drowning prevention education in the Auckland region, which is New Zealand's biggest city. My role focuses purely on drowning prevention within new migrant, refugee and Asian communities in Auckland. So just to give a bit of background, we have about 1.5 million people with a large number born overseas. These numbers are most likely to be increased as these numbers were taken from our last census in 2006. Our environment poses a risk for drowning. As you can see from the pictures, we've got a number of lovely coastlines. We've got 3 harbours and 2 major estuaries running through the area, and they are promoted as tourist attractions, which I'll talk about a little bit later. So just to give you a bit of background and a snapshot of our drowning statistics, which provides the evidence for the good idea that I'll be talking about soon. So you can see here, Auckland does have higher numbers reflective of our population. The land-based fishing that we talk about are things like rock fishing, which are very popular within our Asian communities. That's a separate project that I'll talk about. Immersion accidents, this means that people are not intending to be in the water at all. And the worrying thing for us is last year, the number of Asian people that drowned was 3 times the 5-year average. So what it normally would be for the 5-year average, the total number of people drowned in 2011. However, in saying that, Auckland also has one of the lowest rates of drowning per capita in New Zealand as well. So we like to think that we're doing a pretty good job. So as Piali mentioned, one of our good ideas is that we have a new settler water safety strategy. One of the key actions or key areas of the strategy is the new Settlers Water Safety Reference Group. This was established in response to the increase of new migrants drowning and being rescued, and it's about bringing together all organisations working with new migrants across a range of sectors, being health, education, injury prevention, settlement support and other areas. And it's always open. We meet quarterly, and it's always open for new organisations to join us. We found that it's very good for understanding and learning from all organisations and encourages ways to support and encourage community participation across the services and linking services together to achieve the common goal of improving accessibility and information for our new migrant communities. So some of the theory to practice that we've done within the group and we've linked in together. One of the things I do is water safety is part of an orientation program for quota refugees into New Zealand, and that program also includes things like the police coming in and doing things, fire service, job preparation, all those sorts of things as well. So every group that comes into New Zealand has a water safety talk. So that for me, I go in 6 to 8 times per year, and the groups range from about 70 to 150, and that's adults and families as well. So we've also started going into international schools and units or community adult education. This year so far, it's approximately 17 to 20 talks with around 1,000 students, and we're halfway through the year, so there'll be more coming up as well. So as I've said before, and you've seen the photos, the beach and the aquatic environment are very much part of New Zealand culture, and they are promoted as tourist attractions. So we need to provide that information, but as most of the new migrant communities have English as a second language, they do need to be delivered in a practical and interactive way for them to take in and understand the messages and the importance of keeping their people safe around water. Things like taking in life jackets. You can see from the photo that all the adults and the children are wearing life jackets. Many of them have never seen one, let alone wore one. So it's about making it as practical as possible and also making them understand those messages. So we've got a number of translated resources, and these languages are reflective of the community. So we consulted with the community, and these were the main languages that are coming through from our new migrant communities. The other thing that we've found have been very useful is being at community events. So these are the community events I've been at, the ethnic community events, and they've been very good in raising awareness of our messages. And they're great to partner with other like-minded organisations to increase awareness within the community. The more events that we go to, the more the community gets to know our organisation and the messages that we're trying to promote, and more likely to invite us back at another time as well. So the wider outcomes and benefits, I mean, there's lots in terms of health and well-being, of course, but we also look at it in a wider holistic point of view. So learning about the New Zealand culture, it's an opportunity to practice English skills outside the classroom, increase confidence to access wider community services. There's been a positive interaction with other ethnic groups as well, continued participation in swimming and other aquatic activity, decreased mental health and social isolation within communities, and increased employment opportunities as well. So it's, as I said, it's not just about learning water safety, it's a holistic learning process. And then for us, it's an opportunity to understand other cultures, and the benefit for us as well is increased media interest and uptake, particularly with ethnic media, that can be quite hard to engage with. So transferable practices that I think that other organisations around the world could pick up. So partner with settlement support and language schools, English resources, learning English, consulting with the community is a big one. It grows trust, it grows a relationship, and it tells them that you really care about what they actually want to do as well. I've already talked about community events, and identify community champions who support the work that you're doing. So that's been very helpful for us. We've found that other organisations, not just water safety organisations, have modelled from this practice, and we like to think that we're seen as being proactive. So we set the example rather than reacting, waiting for a drowning to happen before we go into the community. So we're definitely a lot more proactive. Right. So the other practices that we've seen as well, so our program or the water safety messages have been incorporated into workplace health and safety programs. So you might not think of water safety and how it can be put into workplace programs, but that's something that we're quite pleased about. The use of the English as a second language water safety toolkits and resources have been used around New Zealand and internationally as well. And as I've mentioned before, that our local settlement support agencies frequently use our resources not only for safety messages but for teaching English. So learning takeaways that I can pass on is relationship building with new migrant communities is very important. You may need to meet with your targeted community a number of times before you can deliver or present your work. This builds up trust with the community. It gets them to know you, and you can learn more about the community as well. But I would say that's very, very important. You can't just go on and do a one-off presentation because you lose that trust and they may not want to have you back. Identify and meet with people already working in the community to learn more about the community and see where you can link in with what's already going on. So it's great to see if you can link in with existing programs or existing events that might be coming up rather than trying to do a one-off. The community might already be involved in a lot and they may just see your thing as being one extra thing. So we've found that being very useful as well. The other thing we've learnt, and I'd like to pass on, is be aware when translating materials, as some communities may not be literate in their own languages as well. So just something to be aware of, and again that comes in with your community consultation. And make sure you make it relevant to your community. So why do they need to learn about water safety or road safety or anything like that? Make it relevant. Some of the groups I've worked with before have been elders groups, and for them, they don't need to know about personal water safety or swimming skills for them, but it's about keeping their families safe around water. So it's trying to find that relevance and that common view with your community and with your targeted group. So thank you very much. I look forward to your questions, and I hope that wasn't too fast. So I'll hand it back over to Piali.
Thank you, Stacey, for sharing WaterSafe Auckland's local success story. Now, from one city to the next, we now shift to Vancouver. I'm delighted to introduce Lynn Moran from the Affiliation of Multicultural Societies and Service Agencies in Vancouver, Canada, to share the successful strategies of the Diversity Health Fair, a free community event that brings together representatives and volunteers from ethnic communities across the city to provide health care information to new immigrants in fun and easy-to-access ways. Hello, Lynn. Welcome to the Learning Exchange.
Hello, Piali, and thank you. Also, thank you to the Métis Cities of Migration for inviting us to take part in this webinar today, and to Evelyn Sue for all of her support. And also for all participants, good morning, good afternoon, or good evening, wherever you are. Let's start with a bit about AMSA. AMSA was formed in 1977, and this year we're celebrating our 35th anniversary and are quite excited about that landmark. AMSA is a province-wide association that strengthens the capacity of its 70-plus member agencies that serve immigrants and build culturally inclusive communities. The total population of British Columbia, for those who may not be familiar with the province, is over 4 million people, while the number of people living in Vancouver is approximately 603,000. Approximately 45,000 immigrants arrive in BC annually, and a quarter of the BC immigrants choose to settle in Vancouver. So Vancouver population is reflected at 45.6 people. 45.6% are foreign-born, 51% are visible minorities, 50% have a mother tongue other than English. Our largest ethnic communities are Chinese, South Asians, and Filipinos. So how did the health fair, or the idea of the health fair, get started? It started with AMSA's Multicultural Health Committee that was formed in 1985. This committee was made up of AMSA members, social workers, researchers, community health organization. And for years they'd been hearing about barriers that immigrants were faced when trying to access health care. And the barriers were language and cultural barriers. And also, people were not sure about the province healthcare system and how it worked. Uh, so we were hearing from settlement workers that work with our member agencies that when they had clients, they had a great deal of difficulty having those clients access various health care services. And then on the other side of things, we were hearing from community health organizations that they were developing programs to support newcomers to the province. But the immigrants were not taking them up on the programs. They did not seem to be interested. So there was this sort of stalemate where two sides were having needs, and those needs were not being met. So then came the idea of what if you got people out of their silos, because often different sectors, at least here in BC, people tend to stay in their own sector and not interact with other sectors. So we thought, well, let's try to bring these two groups together, the health serving agencies, which included community and provincial health serving agencies, and the settlement sector. And how to bring them together was the big question. So we thought, well, what if we had a health fair that targeted the newcomer community, and would others be interested in taking part in this? So we did a bit of a survey, and we consulted with a number of community groups about the idea, and everybody thought it was a great idea, and yes, they wanted to take part in it. So we were off and running, as it were. So the first thing we did for our first health fair, which was in 2005, was we set up a steering committee, and we felt that the steering committee was going to be the key to community involvement and really making the health fair a success. So on that steering committee, we included government representatives from the federal, provincial, and municipal government, representatives from the health authorities. Our province is divided up into regions, and each region has a health authority that is responsible for health programming in that region. AMSA member agencies, of course, were there, and community health organizations, and of course community leaders from the ethnic communities. So all of these people made up the steering committee, whose job was to plan, promote, and organize the health fair. So you ask, well, what does this health fair look like? Well, the health fair has a number of components. I think the most important component is that it is offered in multiple languages, and I will talk a little later about how that works out. So your health fair model, and this is a model that has been replicated, usually starts with an opening ceremony, because the main goal of the health fair is to provide opportunities for newcomers to access resources and to basically enable them to take charge of their own health. But we also wanted it to be a fun and free event. So we start with an opening ceremony at which we have government participants, we have the exhibitors that will be at the fair participating, and the participants themselves. We usually have some kind of band playing, or we might have a lion dance. It sort of changes every year, but it's a very fun activity that involves the group that is there. As well, before the fair, we develop a theme, a health theme, for the fair, and some of the examples of health themes that we've had are emotional well-being and cancer prevention and early detection. And when we are inviting exhibitors, we target our exhibitors according to the theme for that year, but obviously there are exhibitors who provide other services to the community who would also be there. The staff is key. We hire special staff each year to coordinate the fair. We have a health fair coordinator, we have a volunteer coordinator, and we also have a liaison health fair assistant person. And all of these people are working very diligently to bring the health fair to a successful conclusion. And I just want to mention to you, if you're thinking, boy, that's a lot of staff, we had 3,500 people at our health fair last year. So that puts it in some kind of perspective in terms of the scope of the fair. And of course, our volunteers are all important. We have usually around 75 or 80 volunteers who are multilingual. Last year, they spoke a combined 30 languages. They have particular job descriptions, so they know what they're doing at the fair. They have an orientation. We have volunteers return year after year. Many of our volunteers are actually newcomers to themselves to Canada, and it's a great opportunity to be involved in a major event and also to learn the benefit of volunteering. Our exhibitors, we have an average of 50 exhibitors every year, and these can range from people who belong to major national organizations like the Canadian Diabetes Association. They may be involved in safety programs, for instance, involved in, none with water safety, but car safety, seniors safety, mobility safety, and poison control or drug program safety. So a wide range of exhibitors. We also have some very hands-on exhibitors that may be doing shiatsu massage, or they may do reflexology, maybe chiropractors or naturopaths, so a really wide range of exhibitors. Now, the most important part of our fair and the most popular part of our fair are the health screenings, because we must remember that the reason for having the fair is that many immigrants have troubles accessing the healthcare system. So they don't know where to go to have their blood pressure taken if they think they may be hypertensive, or if they think they may have diabetes, they don't know where to get their blood sugar taken. Done. So with these health screenings, we provide those kinds of services. This year, we actually, for some of our health fairs, actually had a mobile mammogram screening program, which was incredibly popular. And just to let you know the importance of the health screening, at one of our fairs in the north of British Columbia in Prince George, the Northern Health Authority there, which is the provincial government health body, was doing blood pressure screening, and they ended up sending 6 people directly to the emergency ward at the local hospital. So these health screenings are all important. As well, we do fitness and cooking demonstrations, and when I say demonstrations, they're interactive workshops. So if it's yoga, people are up there doing yoga postures. If it's Zumba, they're there doing Zumba dancing, etc. Our cooking demonstrations focus on nutritious, very economical meals. We have a variety of workshops that focus on the theme of the fair, whatever at the given year. We have a huge children's activity area where children must be accompanied by their parents, and there are many activities that they can do, from gym activities to playing hockey, etc. And we have partnered with Parks and Recreation here so that they coordinate the children's activity area. Parks and Recreation have community centers throughout the province of BC, so it's a natural partnership where people get interested in various activities, then they can go to their local community center to take part in them. Of course, we have entertainment. Always we have entertainment. We could have Bhangra dancing. We could have Zumba. We could have Vietnamese line dancing, etc. So it's a very lively, interactive event. We have over the years worked with our exhibitors to ensure that they not only have translated material that they can learn from. So benefits to participants are many, and we do evaluate the fairs every year. And some of the things that we learn is that because it is a free family event and it's a welcoming environment and has on-site access to health screenings, interpreters, and translated resources, it connects with our target audience who are newcomers to Canada. 72% of our survey participants increased their knowledge of cancer prevention and early detection. And I'm focusing now on last year's health fair that had the theme of cancer prevention and early detection. 64% of them learned how to access early detection screening services. 57% of them reported being a lot more confident to make lifestyle changes, and 60% were very likely to use the information received to make lifestyle changes. And this information came from our responses to a survey of 189 participants speaking Cantonese, Korean, Hindi, Italian, Japanese, Mandarin, Persian, Farsi, Polish, Portuguese, Punjabi, Russian, Spanish, and Tamil, Tagalog, and Vietnamese. So this gives you a good indication of who is attending the fair as well, from which communities. The benefits for the exhibitors, of course, are all important, because if your exhibitors don't feel that they are reaching the communities they want to, it's not a positive experience for them. One of our indicators that we feel really exemplifies that we are providing the exhibitors with what they need is that over 95% of them in 2011 indicated that they would return to next year's health fair. Now, with the exhibitors, it's very important to have a variety of exhibitors. And this is not only great for the participants, but it provides a really great networking opportunity for organizations that are working in the field of health promotion and disease prevention. So there is, for the exhibitors, a really good opportunity to disseminate information from their organization, to interact with community, to encourage people to come to visit them at their organization. It gives them a great opportunity to do profile building because as you see, I hope you can see in the pictures that we have here, you can see the crowds of people, and the exhibitors all have an area to their own where they can put up their own marketing materials and speak to whoever is attending. To support the networking piece, what we do is encourage the exhibitors the day before to set up their exhibits, and it gives them an opportunity to network with each other, because as you can imagine, the day of the fair, when they're interacting with the 3,500 participants, there's not a lot of time to network with each other. So, of course, we have been learning. The health fairs began in 2005, 2006 in Vancouver. They were very successful. AMSA's Diversity Health Fair was actually recognized by the City of Vancouver with the runner-up for the Cultural Harmony Award in 2006. In 2007, we began to think, well, now that we sort of have this health fair model kind of down and we've learned a lot about what makes it work, what we need to change, we thought, well, why don't we invite some of our member agencies from around the province to attend our health fair in Vancouver to see if they might be interested in doing one in their own community. So in 2008, 3 communities decided they were very interested in holding health fairs, and they attended and they did hold those health fairs in their communities using the model for health fairs that we have developed. So just as a quick overview, we have been learning, we have been growing. Between 2005 and 2012, we've had 40 diversity health fairs around the province with 42,165 participants at those health fairs. I think one of the unexpected outcomes for us was that we really didn't think the health fair model would be such a popular, and I consider it a community development model. And we didn't think it would be so popular and so many communities would be interested. So you're probably not familiar with the province of BC, but the communities that we do have that have done health fairs are Vancouver, Abbotsford, Campbell River, Kamloops, Kelowna, Maple Ridge, Nanaimo, Prince George, Surrey, Vernon, Victoria, and Terrace. And this goes to the north and south of our province and east and west. We have really one of the key things that has supported us is the strong support of ethnic media. They have been on board, written media, radio, and TV media. The other thing that has been a strong support for us is our provincial government, and I think that support has built over the years. It was a little lukewarm at the beginning, but now we have provincial government agencies that want to be at all of the affair. In terms of transferable practices, I think that the most important thing when we were starting out was the reaching out to community partners as well as the business community to ask them if they were interested in this kind of an event and to support the event by either being exhibitors or through sponsorships. And this has led to so many community health organizations wanting to attend the fair, as well as the health authorities around the province, and many government branches want to attend and are at all of the fairs. Because the reason for this is because it's a win-win situation. This is a great opportunity for them to reach the immigrant communities that they are wanting to work with. And the picture on the screen that you can see, it says Diversity Health Fair, is our program, and obviously every fair has a program, which is basically a user's guide to what is happening at the fair. And the fairs are very large, and as I went through before, very, very, very many components. But the basic thing about the fair and the way they are structured is that they are free. They're an interactive, fun event with lots to do and take part in. If you don't speak English, there are interpreters there to help you. The exhibitors at their table will always have volunteers or staff who speak at least one other very accessible for immigrants and a lot of fun. Now, it's important to note that with the fair being duplicated around the province, the role that AMSA plays is different for those fairs outside of Vancouver. We do not coordinate them and implement them. Rather, we play a coordination role. So we support the communities that are planning and implementing their fairs and support that process. And we actually attend all of their fairs to give them guidance and also to promote the theme, the annual theme of the fair. So some good ideas, and they're also, I think, transferable, is not only to know the community, but to involve the community from the very, very beginning in the planning and the implementation of the fair. Because once people are on board and get excited about doing a fair, there's no stopping them, and they're doing a lot of outreach to their communities in turn. And partnering with multiple stakeholders, once again involving them from the get-go, from the very beginning, and getting them excited about it. I think the first year or two of the fair, we spent a lot of time marketing and marketing and marketing and getting people excited about the idea and wanting to take part in the event. And the other thing about the event is it is quite a complex event, and we always encourage everybody that are planning an event to take time to organize with their community partners, get people on board, and the length of time for planning an event is usually 4 to 6 months. So they're quite time consuming, but at the end of the day, I have to say, the comment that I hear as I go around with Dora Raplansky, who is with me here today, our Multicultural Health Coordinator, what we hear before the fair is even ended is, "This was great. Can we have another one next year? Will you support us to have a health fair next year?" So it's one of those events that really builds excitement, and people can be involved in and see the value of almost immediately. So I just want to wrap up and say thank you to everybody who is participating today, and once again, thank you to Maytree.
Thank you, Lynn, for that excellent presentation and empowering multicultural communities to safeguard their health and well-being through greater awareness and participation. I hope all of you have learned as much as we have from these innovative and practical ideas. You'll notice there is now a new poll on the screen. Let us know if you would like to adopt today's good ideas in your city. You can cast your vote anytime before the session ends. We have now concluded the formal presentation part of our webinar. It's time for our Q&A. We will also be welcoming Dora Plansky, the Multicultural Health Coordinator at AMSA, to join us for the Q&A. Please continue to submit questions in the Q&A box while we move to our first question. And this is for both Lynn and Stacey. What lessons does your work on newcomer health and safety have for mainstream service providers regarding community health and safety?
Hello everyone, this is Dora. I will take this question if you would like to hear about that. Well, about the mainstream providers, as Lynn mentioned, we have the Multicultural Health Committee, and also we usually, for every diversity health fair, we set up the steering committee, and also the mainstream health practitioners are participating as exhibitors in each of the health fairs. So through all these areas, they learn a lot, and especially simple to more advanced knowledge. From the very beginning, they knew that newcomers face language, cultural, financial barriers, that low health literacy affects their ability to understand health information and to navigate the mainstream health services. Appropriate health information and programs. And also, and that was very important, is a message that AMSA has strengthened all the way through, that immigrants are diverse and that there are some ethnocultural groups that are at highest risk of developing certain chronic conditions. An example was one of the health fairs and projects that supported that by AMSA about type 2 diabetes, and working with members of the African, the Asian, Latin American, South Asian communities in the lower mainland of BC. And also, as Lynn mentioned, the collaboration among stakeholders is another thing that they learn by doing. So they learn that there is a need to collaborate with settlement agencies, multicultural associations, and of course members of the ethnocultural communities. We would like to share some data, hard data with you about what they have learned. in this year health fair that was held at the beginning of this year in March, we asked exhibitors if their participation in the fair, just as members of the steering committee or just by interacting with fair visitors, helped to increase their awareness of immigrants' health and also healthy lifestyle needs. And we got, in Vancouver, 66% of them, the exhibitors, that their awareness increased a lot. And in Kelowna, for example, the percentage was higher. It was 73, and then we have Vernon, 67%, and that was the main fact that we got from the survey.
And how about you, Stacey?
I'd just like to add to that, with mainstream services, I know it sounds very simple, but just realizing that traditional models or ways of working may not be appropriate for our new migrant communities. I think sometimes people do get a little bit caught up in that, and thinking about, as I've mentioned before, being patient, working with new communities, especially communities who have no concept of or don't really understand the health system or anything like that. It does take time to build those relationships and build that trust, and it's very easy to lose that trust and not be invited back. And as Lynn mentioned, it's not just about consulting the community, it's also actively involving them and working with the community, not just for the community. I've found as well definitely a lot better results when we've taken that approach. And don't just make it a one-off occurrence. So I have already mentioned this as well, but even if visits or the events are on an annual basis, make sure you keep in touch with updates or just to say hi, to let them know that you haven't forgotten about them. So that's the experience and I guess just the learnings that I'd like to remind mainstream providers about.
We have a question from Ann Esler, which I think builds upon how you've all answered this question, the previous question. What ways of promoting these approaches to migrant communities have been most successful in New Zealand and Canada? And I think we'll start again with Stacey.
Thank you. Again, it's just about identifying maybe one person, whether it be the community leader, and building up a relationship with them for them to then introduce you to the community. I think you need to have just that trust built up, and it's about, I guess, building that relationship, but having someone introduce you and almost giving an endorsement saying that they want you to be part of the community and for the community to give you respect.
And Lynn or Dora?
I'll answer. Our situation is a bit different because we work very closely with our member agencies who serve the immigrant communities. We found, though, our lessons learned is the marketing of the fair and getting our target audience out to the fairs, and this was best accomplished by working with ethnic media and having some champions of the fair who are actually on the steering committee do interviews on the media, in the media, the radio, and also community newspapers. And in that way, we actually got people out to the fair. At the very beginning, we were really we were targeting mainstream media, and we found that we were not getting the coverage we wanted. So by targeting ethnic media with our marketing, it really served to get people out to the fair, so much so that I will tell you a little anecdote. When our health fair volunteer coordinator was coming to the health fair by taxi, and she mentioned the address where the fair was being held, the taxi driver began to sing the jingle about the fair that he heard on a Punjabi radio station. So, I mean, that was reason enough for us to think that we had done well with our outreach to the ethnic media.
Now we have a question from Maggie Zen. I think all these questions are really building upon each other. What are the barriers that you've identified, and your solution to address these barriers, the lessons learned, and how do you address these issues on a regular basis?
I can respond to that. This is Dora. AMSA has been developing for a long time, at least since 2005, resources for diverse communities, and we built what we call a multicultural health program that people can see in our website. And for example, I will give you an example. We developed for the diabetes prevention year, diabetes prevention postcards in English, Chinese, French, Korean, Persian, Punjabi, Spanish, and Vietnamese. These are created in collaboration with member agencies, but also with experts in type 2 diabetes. And the idea is to make the message with plain language, not only translated, but knowing what the different communities think. We conduct focus groups, key informant interviews. This is the way we develop resources, and we make it accessible to our members agencies. We also have developed public service announcements, and that are also in our website. The public service announcements deal with the same topic. Type 2 diabetes we know is an epidemic, and AMSA wanted to contribute to reduce the number of people who are at risk.
And Stacey?
For us, I was speaking to this with Lynn earlier. It's around the communities being ready for your or prepared for your messages. Some communities may just not be prepared. They're thinking about other things, whether it be jobs or education and things like that for their family with immigration and coming to a new place, whereas they may not recognise not just water safety, but I think other health issues as being important to them at that time. So we do need, that has been a barrier. Particularly with us, with some of the statistics we've been getting showing us that certain groups are now increasing in the drowning statistics. So we do have to be careful approaching communities because they may not feel like that's a priority for them at that time. So it's around just working in, and again, like I mentioned in my presentation, making it relevant for them. So they may not see as swimming, learning to swim, being important for them at that point in time, but when you mention it's around keeping their families safe and learning about New Zealand culture, then it becomes a priority for them as well. So just being aware that that these people are getting a lot of information when they first come into the country or when they are first settling, and so it may not be the right time to promote your message even though you might think it's important.
We have another question that really relates exactly to that point, whether both groups have different programs for different age groups, such as women, seniors, and children.
We do definitely. In terms of we've got a couple of programs running for ladies only swimming. There's obviously a few cultural barriers for some religious and cultural groups to not swim with male and female and in public swimming pools. So we have a couple of women's only swimming groups running. One is for women over the age of 18 to give mothers and older ladies a bit of relaxation time, but it's also around physical activity and health and well-being. And there's also another program that caters for young women under the age of 18 as well. So, and we do have a mixed program with ladies from all cultures that can just swim all together as well. So that comes into the social interaction that I talked about earlier. And we do have a number of presentations that are catered for adult community groups, or we do have a team that works within the schools as well.
For AMSA, with our health fairs, we really target the family, which means that there's something for everyone at the health fair. So some of our exhibitors will be focusing on children's safety. Other of them will be focusing on women's health, breast self-examination, mammograms, etc. And others are focusing on youth. Our fitness demonstrations that I spoke about are really range from chair yoga for seniors to the very interactive, very active Zumba dancing. And so all ages can take part, and there are particular things targeting particular age groups. With our entertainment, it's also very interesting. We could have a child performer, or in fact we have a children's choir that started off our health fair last year, right up to a seniors line dancing group that performed. And with all of the groups that are performing, we try to involve everybody, seniors, children, women, men, youth, and so that everybody is working together. And one of the things that we found often at the health fair is that the whole family comes, and many times a grandmother, a mother, and a child will come to a booth, and the mother and the child are actually interpreting and helping the grandmother who may not speak the language of the person at the booth, and so they serve as the interpreters. And it's really wonderful to see a family learning together and supporting each other to learn and to access the resources that are being provided.
Okay, we're almost near the end of our session. We have time for one more question. We know that ensuring access to information and promoting services is a challenge for any health and safety agency. What is the relative importance of language, culture, or good marketing in reaching out to immigrant communities? And what was the tipping point around your program's success?
Piali, I will take the response for AMSA from the point of view of AMSA. You mentioned the reaching out to immigrant communities. We mentioned that we reach them through our member agencies, through the diversity health fairs, developing resources, and with regards to the relative importance of good marketing, was a very important feature to reach ethnic communities and invite them to participate in the health fairs as volunteers and visitors. It was very relevant, using a lot of different methods of reaching: radio, TV, social media, the ethnic media, and also going to allow us to reach ESL students, or students that are learning English. This agency is called English Language Services for Adults. They are best known as ELSANET. And this allows us to reach English as a second language students who are mainly newcomers and encourage their participation in the health fairs. You also asked me about what really makes the difference. Well, we are an umbrella agency, so we listen to our member agencies and community partners that provide services to newcomers, so we have an updated knowledge of what our newcomer needs. And also, we try to learn from past experiences. This means paying attention to recommendations made after each of the health fairs by all the stakeholders. And also, you mentioned the tipping point. Lynn made also reference to the tipping point. A significant change took place in the process of reaching out to diverse communities when many AMSA member agencies showed that they were interested in organizing diversity health fairs, that the ministry expressed interest in providing funding for the health fairs, and that representatives of health authorities in different regions of BC began to participate in the health fairs, steering committee members, as exhibitors, as health screening providers, and sponsors. That was the tipping point.
Stacey?
I'm going to touch on both of the things that Lynn and Dora have already mentioned, but for us, with one of our projects in particular, what was very successful was engaging local people who speak the language. I mentioned right at the start that the numbers of people drowning from land-based fishing were increasing, and we identified that the people who were fishing off the rocks were mainly Chinese and Korean. So we developed what we call the West Coast Rock Fishing Project, and we engaged local people, Chinese and Korean fishermen, to go and speak to the people on the rocks, the fishermen, and the safety messages in their own language. The project's been going on for the last 6 years, and we've seen slowly the decrease in drownings for fishermen off the West Coast, and we do attribute it to the success of having those people on the rocks, being able to converse and talk to them and give them messages in their own languages. And also the other thing is, if you're working with the community at the grassroots level, really making the effort to learn about the community before you meet with them. Do a little bit of research, do homework, so you have an awareness and understanding of their culture. I think for us that is really the success with some of these programs, and being able to be accepted by the community. But simple things, I guess, like for me, knowing about dress codes for women going into certain communities, wearing a dress above the knee, short sleeves, and those sorts of things. So, and it shows to the community that you do have a genuine interest in their health and well-being, and you do actually want to help them as well.
That's great. We're at the end of the Q&A, and we'd like to close by asking both of you, or all three of you, some short questions. What is the one most important secret to your success? Lynn and Dora?
Collaboration.
I will say persistence.
Stacey?
I definitely agree with collaboration as well, not just with the communities themselves, but also with your partner organisations or other health service organisations, or whether it be the city council or the equivalent. Definitely collaboration is the best way to go about these things.
And what's next for both organizations? Where are you taking your work? Is there another city, another big idea? Stacey?
Oh, that's an interesting question. There's lots of things that have stemmed out from our water safety reference group in terms of, as I said before, the West Coast Rock Fishing Project and other little projects, resources and things like that. So for us, there's always little projects that are very much in response to what's going on, to all the different community needs. So I think there's lots of little things going on, but it is also very fluid in what we're doing, because it is very much in response to the communities. So that doesn't really answer in terms of big things going on, but in terms of communities, we're always doing new things with our communities.
Lynn or Dora?
For us, we are in the process of negotiating funding with the ministry for the next year. We are planning on continuing posting resources on our multicultural health section of the website. The most exciting thing for me, though, is we're adding a new community next year, we hope, and that is Fort St. John, which is in north of British Columbia. It's a community that has a lot of migrant workers and a lot of not only immigrants to the community, to Canada, to the community, but also a lot of temporary foreign workers that are brought in to work in the oil patch. So it's a new community for us, and it's one that certainly could use the support of a health fair. There are a lot of problems in the community around substance abuse and et cetera, so we are very excited about the opportunity to work in the North.
Thank you. Our time has run out. We will send all unanswered questions to our presenters. On behalf of all our participants, I want to thank Stacey Wilcox from WaterSafe Auckland in New Zealand, and Lynn Moran and Dora Raplansky from AMSA in Vancouver, Canada. These were great ideas. Imagine this excellent work being interpreted in your city, adapted by your organization, or changing your neighborhood.